Assalamu alaikum. Drug nephrotoxicity. Why the kidney are vulnerable for drug toxicity? In any patient with renal impairment or even with normal renal function, we ask the patient to avoid nephrotoxic drug. Why? Because the kidney is suitable for many types of damage or injury due to drugs. Why? Because the kidney has a very big blood flow from cardiac output, about 25% of cardiac output, and the tubular epithelium of the kidney is numerous, and the surface area of it is high. Also, there is high metabolic rate of the kidney, with acidification process of the kidney, and many drugs are excreted from the body via the kidney. So, especially in diseased kidney, you must avoid nephrotoxic drugs. What is the pattern of drug nephrotoxicity? Many pattern of drug nephrotoxicity. Especially, or the most important of it, is acute kidney injury. Acute kidney injury with antibiotic or antimicrobial. The first common cause is amikine. Okay? Amikine is a potent nephrotoxic drug. Cephalosporin, especially first generation. Amphotericin B. What's amphotericin B? Fungizone. Trade name is Fungizone, which is given as antifungal, is a potent antifungal drug. But in many cases of fungal infection, like invasive fungal sinusitis, patient develop renal impairment or AKI, acute kidney injury, after amphotericin infusion. Sulfur and also can cause AKI. Penicillin in many doses, in high dose penicillin can cause AKI. The second most common type is CIN, or contrast-induced nephropathy, in patients with acute coronary syndrome, which undergo this patient undergo to a cardiac catheter. In imaging, cardiologist must inject a dye in the coronary to show the site of occlusion in coronary. This radiographic contrast media may cause AKI, what we call CIN. Also, in cancer chemotherapy, patient with chemotherapy, yes, there is multiple sessions of chemotherapy to treat the cancer. Before any session of this, must patient do renal function before this, to be sure that the kidney is not affected from this chemotherapy. Also, cyclosporin, which is immunosuppressive drug. Cyclosporin can treat many types of glomerulonephritis, and monitoring of renal function in this patient is important. Non-steroidal can cause acute kidney injury, and this is important. Non-steroidal, yes. Another type is chronic kidney injury, chronic renal failure with analgesic. So non-steroidal can cause acute kidney injury, and they can cause chronic renal failure. This is analgesic nephropathy. Also, heavy metal is very important to cause chronic kidney injury, chronic renal failure, as lead and mercury. Also, there is a drug can cause glomerulopathy, like proteinuria or nephrotic range proteinuria, like gold, heavy metal, heroin. Heroin can cause a subtype of focal segmental glomerulonephritis called collapsing glomerulonephritis with heroin. ACE inhibitor, non-steroidal can cause glomerulopathy. So non-steroidal can cause AKI, can cause CKD, and can cause glomerulopathy or proteinuria. That is non-steroidal. Also, lithium can cause glomerulopathy or glomerular injury, and anti-TB drugs. Acute and chronic tubulointerstitial nephritis, especially with penicillin and non-steroidal, and this will be discussed in tubulointerstitial nephropathy. Obstructive uropathy can cause intrarenal or deposition of crystals inside the glomeruli, what we call deposition nephropathy or blocking nephropathy with cyclovir and methotrexate. Also, what we call with uric acid crystals during chemotherapy. Patient with leukemia and lymphoma present a large amount or a large number of cells, of blood cells inside this circulation. When this patient given a chemotherapy, the cells will destroy it and liberate a uric acid which can block the glomeruli. Also analgesic related stone. But extrarenal, this is intrarenal inside the glomeruli, but extrarenal due to ureteric obstruction. This is a gross pathology from retroperitoneal fibrosis, which can cause after radiotherapy, after hydralazine and the ergot and the alpha methyl dopa. Drug-induced lupus. This is a question of MCQ. Drug-induced lupus with hydralazine, INH, and brokinamide. Hydralazine, INH, and brokinamide. This is very important. Drug-induced hypertension. The most important is steroid. Okay, steroid and contraceptive pills. Steroid and contraceptive pills. Yes, drug-induced papillary necrosis with non-steroidal or analgesic nephropathy. Papillary necrosis with non-steroidal, especially if the patient is diabetic or sickle cell anemia. Drug-induced fluid disorder and electrolyte disorder. The most important of it is hyperkalemia. Hyperkalemia is a side effect of ACE inhibitor, of potassium-sparing diuretic, potassium like aldactone, and beta blocker. So if we recognize the treatment of hyperkalemia was beta agonist, and may potassium, if the patient suffer from hyperkalemia, the best treatment or the best diuretic is Lasix or loop diuretic, because it is a potassium losing diuretic. Okay, potassium losing diuretic. Also, alkalosis can cause due to what we call milk alkali syndrome and ingestion of bicarb. It's important: hyponatremia, narcotics, hypoglycemic agent, and non-steroidal. Hyponatremia with steroid and pills. So, the most important is drug-induced hyperkalemia, ACE inhibitor, potassium-retaining diuretic, and beta blocker. Most important is drug-induced hypertension with steroid and pills, steroid and contraceptive pills. Drug-induced hematuria with anticoagulant and endoxane. What's endoxane? Cyclophosphamide leads to what we call hemorrhagic cystitis. Okay, this is very important also. Drug-induced urinary volume change with polyuria, increased urine formation by diuretics. Increase thirst and the cholinergic drugs. Patient with atropine have a drug with atropine-like action leads to dry mouth, which will lead to increased thirst sensation and increased fluid intake. Also, atropine can lead to urine retention. Analgesic nephropathy, chronic renal disease, which is caused by long-term abuse of common analgesic mixture. We call analgesic can cause AKI, analgesic can cause CKD, and the analgesic can cause what we call glomerulopathy. Yes, glomerulopathy. So, analgesic nephropathy is a disease of female. Why? Because the female has less tolerated with pain sensation due to low pain threshold in female, and in old age, because from 40 to 60, because it is a cumulative effect of analgesic to affect the kidney. Renal impairment, this is the clinical manifestation, slowly progressive with acute, no, it's chronic, but may be acute on top of diseased kidney or on top of chronic kidney disease. Also, renal artery stenosis, proteinuria, and glomerular disease is very important, renal tubular acidosis may affect, may be related to analgesic, leads to renal tubular acidosis. Also, due to stone formation, leads to what we call hydronephrosis or back pressure affecting the kidney. Also, analgesic can lead to hypertension and gout. So, if the manifestation of analgesic affect the kidney, it may be an oral exam, like number one, it is chronic kidney disease or acute on top of chronic. Number two, renal artery stenosis, proteinuria, renal tubular acidosis, and obstructive uropathy or hydronephrosis. External manifestation like hypertension. Yes, analgesic can lead to hypertension. Anemia, neuropsychiatric manifestation like headache, and the most important side effect of analgesic is GIT manifestation or gastric erosion and the gastric ulcer, and the impaired liver function and the increased liver enzymes. Yes. A treatment mainly is prophylactic, avoid of non-steroidal, or use of anti-COX-2, not anti-COX-1 like aspirin, but anti-COX-2. High fluid intake, this is very important to anyone. High fluid intake, and symptomatic treatment to hypertension, acidosis, infection, and follow up to detect any complication of the kidney. Any complication affect the kidney or increasing kidney function, or stone, UTI, and renal artery stenosis. And thank you.